we are on partial lockdown, I can say, and so people still move, but I try to move between my house, my old house, and my new house. And moreover, my new house, it's wall fenced. I have the wall fence, and it's spacious, and so we try to come here, and so that's where I spend most of my time nowadays, and that's where I am right now. In Zambia, we do have our own challenges, like ongoing challenges already, that the country has been trying to work on. Things like, poverty levels are quite high, the economy is not doing well. We still have work that's being done around HIV and AIDS. And the coming of COVID-19, it's quite sad, and communities are struggling. And to start with, we have to learn what is this new infection? What does it mean? There's still a confusion. With COVID-19, it's like everyone is at risk. Nobody has the choice. You can have it, whether you are actually vulnerable, you are at risk of having the COVID-19. And so what has been happening is interesting to see how stakeholders have actually come together. People are not supposed to actually come together, gather together like it was with HIV, where you go out in the community and educate people. Here now they are telling people to social distance. And so the community-based organizations are actually coming forward to even help government. Some are giving their vehicles to help the health workers go to the different points to try and work. And others, like other companies, corporate companies, have even branded their cars to be able to support government, with messages of coronavirus, so that people understand in local languages. It has been done so fast than anybody would expect. We have messages in Bemba, we have messages in Nyanja, and they're encouraging people to come forward. So you will see people go, I've donated 100 masks or 1,000 masks, I've donated the beds, we've donated this. And so for the first time, we are seeing that the way we have owned the COVID-19 pandemic is different from the way it was with HIV. Like there's that sense of community ownership. Everyone is saying, this is our country, we love Zambia, we have to do our best. With community-based organizations, there's a lot that is happening. One, the people that have been working, for example, around HIV and AIDS, they are now encouraging health workers to try and trace people, like vulnerable people, trace vulnerable people, so that instead of the vulnerable people going to the hospital, like they go to the hospital to access the services, they've canceled some of the necessary services that people, for example, living with HIV have to go through, like, blood work, whatever. So what is happening is that healthcare workers have come together from different NGOs to be able to trace the people who are HIV positive and take the medication to them. And not only that, some of the organizations have given their spaces to be able to be centers where the government can put, for example, a center to be able to test people for COVID-19. Like they've made it a center to be able to have people quarantined there. We are all learning how we are going to live in the midst of the COVID-19 virus. And so it's quite stressful to my family. They keep telling me that message comes almost every day. Where did you stop? If I come from home, they'll tell me, Mom, where did you stop? Did you stop by the shop? Did you do this? So this whole thing is quite stressful on families, and there's no peace. Like there's no total peace. Every time you go home, you have to sleep and think, are we safe or we are not safe? That is a very big challenge, and people with the numbers going up, like they've already mentioned 3 communities which are overpopulated, and they are saying that government is going to do massive screening there. And that is a place where you find that people go without water for like 5-6 days, and they have only probably one borehole where you will find 40 people waiting for water. And so that is a real challenge that we are facing. And that's why I'm saying the level of interaction here is quite high than probably in other places where some of the basic needs are actually there and people are just being told to social distance. But for us, social distancing is quite a challenge. People have been told to say, you know, you have to wear masks, you have to social distance. But I have to tell you that the level of interaction in Africa is quite high. Grandmothers who definitely depend on the healthcare workers to take them drugs for their grandchildren, because we are not done with HIV and AIDS. I am looking at a situation where definitely it can even go back. All the efforts we have been making can just be, you know, come back and say, you know, things can just start to move on. Like infections can start going high, people start dying. We are looking forward that the situation be stabilized so that we go back to normal. Otherwise, I am worried that, as an AIDS activist, that something may happen again with HIV, like efforts may be unfolded. I just learned how we are dependent on each other. Just like coronavirus has taken the whole world. Like we are just, it's like we are one person. Every corner of the world has been affected by this disease. You hear these people affected, these are more, these are not more. This is where now numbers are mounting. So we are hoping for the better, and we hope that the people who are doing the research, the people who are working on different pieces, that this can come to a standstill and that we can continue the journey that we've embarked on. I look forward that if this disease can come to a standstill, then we can all meet again.